Good afternoon, everybody. Thanks for joining today's session. We are going to give it just about 30 seconds to a minute as we have some individuals joining. So please sit tight and we'll be starting the session shortly. All right, so I think we're all set. We're at a good starting point for today. So thank you all for joining again today. Thank you to Octavius for our partnership and bringing you this session. Today's session is supercharging your practice, smarter remote monitoring for superior results. And in this webinar, our speakers are going to be highlighting strategies to refine data prioritization, optimize efficiency through automation, and turn analytics into actionable insights for better outcomes and growth. Today's speakers will be Rochelle Robinson. She is the Executive Director of Florida Cardiology. We also have Carol Ann Tolbert, Practice Administrator at Aurora Denver Cardiology Associates, and Alana Miller, Lead Advanced Practitioner of Cardiac Electrophysiology at Penn Presbyterian Medical Center. So thank you for our speakers for joining, and thank you to the audience for joining our session today. We're going to go ahead and move into one housekeeping item before we start the session. And that is for our audience today. You'll notice two functions at the bottom of your Zoom screen. That's going to be the chat function. So in this area, you can find the presentation slides should you want to download them and follow along during the presentation. And then we also have our Q&A function at the bottom right. This is going to be there for you guys to type in any questions during the session that you might have for our speakers today. And we'll take some time at the end of this presentation to address those questions with you all. So without further ado, I'm going to go ahead and pass it to our first speaker, Rochelle Robinson. If Rochelle, you wanted to come off camera and unmute, the floor is yours.
All right. Well, good afternoon, everyone. I am so excited to be joining all of you guys virtually today to kick off this supercharged event. We are going to talk about streamlining your practice. Who doesn't love a good superhero, right? Well, I'll be the first to tell you, I'm no superhero, but I truly believe that we can all be heroes in our own practices if we follow some key things. I am one who, my favorite saying is, show me how to work smarter, not necessarily harder. All right. Well, without further ado, we'll start about talking about some of the challenges on the front line. So first and foremost, you got to understand what the challenges are, right? Rising patient volumes, that happens in most practices. While it's a good problem to have, a lot of times that comes with staff burden, right? A lot of extra work for all of your employees. Secondly, is having a fragmented system. Any of you guys have systems that don't all flow together? You've got to go to one place for one item, another place for a second. It slows things down and it makes your practice not so efficient. Or having challenges of difficulty demonstrating measurable clinical data and financial impact. How can you make those all two go together? So we're going to talk about some strategies, right? How to power up your program. Using analytics. In this day and age, you've got to have measurable data. If you can't measure it, you can't see it, right? Automate routine workflows. Use technology to make your everyday workflow work better and reduce non-actionable transmissions. That means when your providers are in there working on the transmissions and the remote devices, we want to make sure they're working on only the things that need to be addressed, right? So let's talk about how we did our transformation. Um, we partnered with Octagos to do a transformation, and I'm sure all of you guys have heard the saying, right? You can't fix what you don't know. That's something that's a common theme, right? So whether you're joining us today and you're on a different side of the spectrum, either you're one of those practices that say, hey, we're a pretty well-oiled machine, we just are following best practices and are doing things pretty well. Or B, you're saying, well, okay, we do okay, but we could use some improvement. Or three, you're one of those practices that says, hey, we're hanging on by a thread, okay? We might be a hot mess and we need some help. Then let's get out of denial and let's figure out how we can all work together to identify the problem. First and foremost, efficient patient outreach is causing missed engagement opportunities. What does that mean? Do you even know sometimes if your patients are being communicated with? Do you even know who's coming into your practice for their device checks? Secondly, limited visibility. That makes it hard to even track and optimize communication. Can you even see out of all of your patient manufacturer portals which one from which company is transmitting, which ones aren't being compliant? There's all these manual follow-ups that we know they drain your staff, their time, and they increase the risk of errors. I mean, we are all humans, and there's a lot of errors sometimes when manual employees are looking through data all day long. What about the inconsistent messages? Those are things where you think, is there a problem? Is it a red? Is it a green? Is it an alert? Is it an error? Those lead to low response rates in your patients. And then lastly, disconnected systems, creating workflow gaps and operational friction. So if you even don't know if your patients are connected, if there's no communication to the office of what's going on with their devices, truly there's some gaps in the workflow. So now that we've identified the problem, we're all about solutions, right? I love it if there's a one-stop shop solution, right? Who doesn't love a one-stop shop? Who doesn't love a BOGO? Who doesn't love a way to say, give me a bundled package and let me have this all in one? Well, there are solutions that do exist out there. So, number one, is this an admission of failure? No. Number two, is this a sign of incompetence? No. But number three, it is a sign that you care about your patients, you care about providing better care, and you want to provide some solutions. So, here are some quick solutions that were offered to us in an all in one package. Improving our patient experience, being able to check the remotes from home. So, these are the basics. Ensuring timely notifications, providing our physicians access to a portal all in one, where they don't have to log into 5 different manufacturers to understand what's going on with their patients, and having onboarding, clinical, and management 24-hour support. So people that are going to get you set up, people that are going to manage your time and give you that support ongoing after you go live. So let's talk about some of the bonus solutions. Cleaning up all of your various manufacturers. You did a combination of all. You did it yourself, you went through the portals, and then you enlisted another company to help you, and maybe it didn't work out so well. Well, the partnership that we picked with Octagos, they helped us clean up some of the errors that we had in our old platform. They helped us coordinate our interface with the EMR, which was actually my favorite feature. This actually worked with our EMR to make a seamless transaction that once our physicians go in and they report and read the transmissions, those reports are signed off, they're downloaded into our EMR. Talk about hitting an easy button, actually be willing revenue that you've missed, all of the patients that you weren't monitoring and put you on a track and a cycle. That was a big part of the billing cleanup that happened for our practice.
Apologies, everybody. I think we're having some technical difficulties with Rochelle and her Zoom right now. So just on the account of her drop off, we're going to go ahead and switch it over to Carol Ann Tolbert. So Carol Ann, if you wanted to come off mute and your camera, we'll go ahead and pass it to your portion of this session. And then if we have Rochelle come back, we'll go ahead and get her presentation up as well.
All right, thank you, everyone. Again, my name is Carol Ann Talbert. I'm the practice administrator for Aurora Denver Cardiology Associates. Next slide will show you a little bit about our footprint and the size of our practice. We've been in practice a little over 50 years. We have 23 physicians and 17 clinic-based APPs with 7 primary care sites and about 12 outreach locations. At best, we were fully staffed with 5 device techs. Now, over a period of time, as we continue to grow and as our patient population has aged and we have more and more devices implanted, what I started becoming more and more concerned about were the patients that we just didn't have visibility over. Our systems were very manual, and we became more and more concerned about whether we were doing our best job managing our entire patient population, those patients who have devices. Next slide, please. So this is a list of the primary reasons we were facing challenges. I would say, to sum it up, really everything was manual. Those at best 5 device techs that we had were actually trying to deal with everything manually. They would come in every day to stacks and stacks of paper. They would have to download from various manufacturer portals. They would have to try to get those reports reviewed and signed. They would have to try to upload them into our EMR system. And not to mention even the challenges related to timing and when was it appropriate to interrogate? When was it appropriate to bill? Were we in that billing window? Were we outside of the billing window? All of this was really manual. And again, looking at that small but mighty team and our increasing volume of patient needs, we became more and more concerned about what might be embedded 3 or 4 inches down the stack of paper, or the patients that might have been missed in terms of their routine schedule for interrogation. We found ourselves with limited access to data. Things felt like what they felt like, but we didn't have objective data to really determine where we were or how well we were taking care of our patients. We were hungry for a cloud-based solution so that our physicians had the greatest flexibility in terms of being able to log on, sign off reports, check in on behalf of a patient that they may have been seeing in the hospital. They wanted to be able to see their latest transmission and their history. And we just did not have, again, a system for doing that when everything was manual. On top of all of that, we actually folded another practice into ours, and we were on 2 different systems, which posed a whole different level of challenges and just an unmanageable, untenable workload for our device techs. And on top of that, one of the remote systems we were using was sunsetting. So we found ourselves in a situation where we had to rather quickly and rather eloquently find a solution that was going to address all of these challenges and ultimately give us really that full patient visibility that we were hungry for, We wanted to know how well we were taking care of patients and whether they were within their monitoring period, and give our physicians the solution that would be the easiest for them to use. Next slide, please. We've been partnered with Octagos for a little over 6 months, which is actually a short time frame, but the results have been truly phenomenal. Again, thinking about the fact that we didn't know what we didn't know, and we were hopeful we were managing well. In the first 6 months with Octagos, we've had incredibly impressive results. There have actually been total patient transmissions processed to the tune of almost 23,000. The added value here is that with the support of the IBHRE techs at Octagos and with their AI solution, they're actually managing the majority of those transmissions for us. To the right-hand side of this slide, you can see the transmissions that were received by the clinic. It's a little over 30% of those total transmissions had to be actually managed by our techs. So our alerts are received by our techs. They are managed in terms of getting those results to our physicians, and our physicians are able to get to them much more easily because they have cloud-based reporting, and our billable transmissions can be focused on much more rapidly by our billing team. So this puts things in real perspective, I think, for those of you listening to this particular webinar, in terms of how we manage the volume of patients and how we can scale up to take care of more people with devices when we have a partnership working with us, and we allow our device techs to work to the top of their license and the top of their ability and free up a tremendous amount of time on their behalf to take care of those in-person transmissions, or to help with the patients that really want to come into the office rather than to be monitored remotely. Next slide, please. This patient growth was completely unanticipated by us. We, again, were really looking for a much more elegant solution to monitor the patients that we thought we were responsible for in terms of remote transmissions. What actually has been a net result in this first 6 months partnership with Octagos is that we've had a 12% increase in our patient population. That did not involve any marketing, any change, any growth in terms of total patient volume in our practices. It was actually truly a pickup of finding those patients that had fallen off of remote transmission and needed assistance being reconnected. So this 12% increase in our patient population is truly organic and completely unexpected as a positive result of the relationship with Octagos. Next slide, please. And this is something that I am very proud of. It gives me much comfort, and that is the patient compliance. Again, in a manual system that we had previously, we hoped, but that is not a strategy, that our patients were connected, that we were taking care of them, that they really were compliant with remote transmissions. With the partnership with Octagos, what we found is that in the 6 months we've been working together, 95% of our patients are actively transmitting. And the 5% that are not actively transmitting are being they're being contacted to actually get connected again. The service by Octagos for this aspect, being able to identify those patients that have fallen off for whatever reason and get them reconnected, talk to them about the importance of remote transmission, is certainly a patient care component that we could not implement on our own in the past. And it's a huge bonus as part of the program. Next slide, please. So in summary, these are really our measurable outcomes. We were a manually based system that did the best we could possibly do, but we really didn't have good visibility of data. We've had a 12% patient growth in just 6 months due to that compliance of 95% of our patients actively transmitting, being able to reach out to the 5% that have fallen off of that schedule and getting them reconnected, and just creating that efficiency in the workflow that we were not able to produce with our limited number of device techs internally. That has again freed up our device techs to really focus on the in-person checks and to be more available to our patients when they come into clinic. A additional measurable outcome that has been remarkable for us is the streamlined billing and reporting dashboards. That is a very, very manageable workload for our billing team. They come into a dashboard that shows them the reports that are due for signature, so we can easily communicate with our physicians and provide them lists of the patients that have transmitted, and we just need reports signed off. And then our billing team is able to pick those up and very rapidly and with much more rapid turnaround than historically was the case, bill out for those transmissions that are billable. So ultimately, the partnership has allowed us to really work to top of our ability in clinic and to have that reassurance that when we sometimes ebb and flow, our device techs are out, or we are trying to recruit someone to backfill an open position, we've got certified techs that can help us and in a much more efficient workflow overall. And now I'm happy to pass it over to Alana.
Hi, everybody. Thank you so much, Carol Ann. My name's Alana Miller. I'm a nurse practitioner, and I've been working in cardiac electrophysiology for over 10 years now. I'm the lead advanced practice provider for the electrophysiology group at Penn Presbyterian Medical Center in Philadelphia, Pennsylvania. And today I'm going to take you through the clinical impact of optimizing remote monitoring and how we've been able to do this through our utilization of a third party. Remote monitoring is a huge challenge, and I hope at the end of this webinar we'll have some time to hear from you all about what your biggest challenges are for your remote monitoring clinics. The scope of remote monitoring continues to grow larger and larger, more patients, more transmissions, more demand for real-time responses to alerts. Carol Ann has done an amazing job describing her own challenges and perspectives from an administrative standpoint, and hopefully Rochelle will be able to finish her story. But I wanted to take some time to talk about our remote monitoring journey at Penn Presbyterian from more of a clinical perspective. So we monitor approximately 5,500 patients via their implantable cardiac devices. The challenge that we faced is the same as many groups, increasing volume without additional staff. So budgets are tight, many health systems are struggling, justifying additional staff is nearly impossible. What we found was that we were really struggling to keep up with the volume, but most concerningly, the alert volume. We have one APP designated 5 days a week for remote monitoring. This previously included reviewing routine transmissions as well as the clinical management of the alerts. What we started seeing was that as our patient volume increased, that APP was spending more time reviewing routine transmissions, and this left less and less time for alert management. At the same time, the technology continues to advance, which means these devices have a greater ability to detect arrhythmias, device issues, fluid accumulation, etc., meaning that there's also an increased frequency of clinically actionable alerts. Ultimately, we are all here for the patients. So while billing routine transmissions and collecting revenue is obviously essential, the patient care is really where our priorities lie. So we knew that we needed to make a change in order to continue to provide the high level of care that our patients deserve. Next slide. This is where a third-party remote monitoring company comes into play. Our solution was to leverage the technology and service that a third party can offer. So from March 2023 until now, our clinic has generated 209,749 transmissions. 66% of these were reviewed and dismissed by Octagos, meaning that 66% of these transmissions weren't billable or clinically relevant. 34% were reviewed and then sent to our clinical portal as either a routine billable transmission, a red, yellow, or a white alert transmission. 71% of these, or 51,140, are routine transmissions with no alert. These are billable but not clinically actionable. 20,889 transmissions were processed as having some kind of clinically relevant data. By partnering with a third party, we were able to eliminate all of that other noise and focus on only the clinically significant transmissions. This provided immediate relief to our staff. We were able to devote our time more appropriately where it was really needed and continue to absorb our growing volume by utilizing the APP staff more efficiently. Next slide. Yeah. Automation of the transmission review process and initial filtering of transmissions has allowed our clinical staff to review the actionable transmissions more closely and go beyond the alerts to investigate trends. EMR integration allows patient information, including relevant history and medications, to be easily viewed in one location. The improved usability of the third-party platform rather than each individual vendor portal allows us to easily see all of the patient's previous transmissions in one location, along with alerts and clinician notes. This enables us to dig deeper into the data and view patterns not only for individual patients, but across the clinic as a whole. Viewing the remote monitoring information in this context allows us to provide more precise and individualized patient care faster. Next slide. This shift allowed our providers to focus on clinical care and early intervention. Our APPs are now spending less time on normal and more time where we can make the most difference. One of the trends that we quickly noticed was that there's a lot of correlation between increased arrhythmias and worsening heart failure diagnostics. This probably seems obvious, but historically we've left the heart failure management to the heart failure group and not devoted too much time to analysis of the heart failure data, apart from occasionally passing it on to them. It became clear that we were missing this signal in all of the other noise of remote monitoring. With the invention of the multi-sensor algorithms within several of the device manufacturers, the heart failure diagnostic data from implantable cardiac devices is now much more accurate and actionable than it has been in the past. We were able to partner with our colleagues within the heart failure group to enroll their patients in heart failure remote monitoring utilizing Octagos. The Octagos portal pulls heart failure transmissions into a parallel heart failure clinic portal. This allows the heart failure data to be easily viewed, managed, and billed by our heart failure providers instead of getting lost within the noise of the regular EP-focused transmissions. Prior to initiation of our heart failure remote monitoring program, we were only billing for heart failure in our CardioMEMS patients. But since starting this program in July of 2025, we're now monitoring 151 heart failure patients with hopes to continue to expand. Next slide. I personally believe that the future of heart failure management centers around successful remote monitoring of heart failure diagnostics, and we're trying to take this idea one step further at Penn Presbyterian. We're currently only enrolling patients in our remote heart failure monitoring program if they're followed by one of our heart failure specialists. For these patients, we're able to identify early warning signs of decompensation and actively titrate medications according to protocols that have been established by our heart failure providers. For all of the other patients, we are developing a process to leverage the technology within the platform to detect rising heart failure risk scores across all device reports. If a patient is identified as having elevated heart failure diagnostics and they're not already enrolled in our heart failure monitoring, this will trigger a letter to be sent to the patient's referring provider, informing them of the identified increased heart failure risk and offering a pathway for an urgent appointment with one of our heart failure specialists. Heart failure diagnostic data is often overlooked, but we've been able to create a workflow that brings this important information to the surface, which benefits our patients as well as all members of the multidisciplinary care team. Next slide. Ultimately, utilizing a third-party remote monitoring company has helped by allowing our clinicians to practice at the top of their license. Each remote transmission has already passed 2 sets of eyes before reaching my clinical team. The initial pass is utilizing AI, which triages the routine transmissions and highlights abnormal findings. The second is an IBHRE certified reader, who's able to review the transmissions in the context of the patient, evaluate EGMs, and triage alerts, so these can be easily viewed and interpreted by the providers. By the time we see the reports, we feel confident that the normals are normal, so we can devote our attention where it's needed most. This workflow has allowed our remote monitoring program to grow and our team of APPs at Penn Presbyterian to operate at the highest level of their education and training. This has resulted in improved quality of care without adding additional staff, as well as increased job satisfaction for our advanced practice providers. Next slide. As we wrap it up, let's take a look at the overall impact of utilizing third-party vendors to assist with remote monitoring. First, it improves data quality and standardization. By providing standardized reports and consistent workflows, clinicians can trust the data they're viewing and make better, faster decisions based on accurate information. Second, we see improved efficiency. So utilizing AI to review data and provide initial triaging reduces that manual workload for the clinical team. This allows us to spend more time on patient care rather than administrative tasks. Third, remote monitoring improves healthcare utilization. So by identifying potential issues early, we can prevent unnecessary clinic visits, hospitalizations, freeing up valuable clinic resources and improving patient convenience. We also achieve faster response times. Alerts are automatically processed and escalated, ensuring that timely intervention can take place before a patient's condition worsens. Advanced analytics and pattern recognition further enhances care by identifying trends and risk patterns proactively. This supports a more predictive and preventive model of patient management. And ultimately, all of this leads to enhanced patient outcomes. Early detection of arrhythmias, device malfunctions, and heart failure trends means patients receive safer, more personalized, and higher quality care. Just to summarize, by leveraging third-party remote monitoring solutions, we can improve clinical efficiency, strengthen patient safety, and deliver more proactive, data-driven care. Thank you so much. That's it for me. Now I think we're going to try to go back to Rochelle.
Okay, can you guys hear me?
I can hear you.
Can you guys hear me? All right. Well, look at that. Well, thank you, Alana. Appreciate you tossing that back. Gotta love technology. All right. Well, thank you so much for getting me back on track. Most of my colleagues here shared their patient count progression. So I'll share the story here at Florida Cardiology, where we too have been on the platform for quite a while. Our go live was January of 2022. But like I mentioned before, we were actually on a different platform. And Artegos helped 3 months for us to run parallel systems so that we could clean up our portal and be able to go live with their patients. Now in 2025, we're happy to report that we've had 130% increase uptake from our patients. Next slide. Okay. Alana shared the statistics from her group as well as Carol Ann from hers as well. And again, you can see the percentages and the number of transmissions that we have been able to improve by using a platform such as Artegos. Next slide. Okay, here's where I wanted to spend a little bit of extra time because to me, the real superheroism really comes from getting a bonus for using something that you're going to use anyway, right? And using it and not even knowing that you're getting a bonus. So some of you may be familiar with the value-based merit incentive program called MIPS. This is a program from CMS that's been around for several years now. It replaced a quality program called Meaningful Use when EMRs first were really being known to demonstrate how effective they could be. So MIPS in a nutshell, this quality measuring from CMS is an annual reporting that is designed to give payments for quality and cost care when you show that you're actually improving these processes and the health and the outcome of your patients. So the main parts of MIPS are in 4 categories. The first one, 15% of your score for MIPS is by improving activities, assessing how you can improve your care of your patients, and increasing their access to care. Anybody who uses a patient portal in your practice or patient surveys, you would then get 15% of the MIPS score just by having that patient portal or surveys in place. 25% you get for promoting interoperability. That's a mouthful, but this is the bonus. This was the Octagos added bonus for us. So this is where you have patient engagement, and it's a two-way exchange of information from your EHR to your patient back to your system. Well, for us using Octagos and through the remote monitoring process, our patients are able to engage 24-hour coverage with their remote monitoring because those reports come back into our system. Automatically, all of that stuff gets recorded in your EHR, and that's how we got 25% score on our MIPS due to that engagement bidirectionally through Octagos. The other 30% of MIPS is quality measures. I'm sure most of your practices have 6 to 9 measures that you're trying to keep track of, whether it's hypertension, diabetes control, smoking cessation, these types of screenings. All of those go into your quality processes. And then lastly, CMS is measuring your practice on the cost. What is the cost that your doctors provide? They calculate this by looking at your NPI number, whether you're an individual or a group, and they look at how much of the healthcare dollar is actually spent under your doctor's reporting through your claims data. So if your patients are going out and they're having repeat tests or they're having checks and ultrasounds and things done that are at the hospital, if their admission rates and all of those things are going up, all of those drive up the cost. So out of these 4 categories of MIPS, we got that promoting interoperability as a bonus payment just for having a system in place like this. So again, that was definitely an added incentive for us. Next slide. Okay, well, I will summarize with showing the impact. When you tie this all together, what's truly our practice scorecard? How did we do for making these changes? Well, number 1, we had a 130% increase just in charge capture. Again, capturing the patients that we weren't monitoring, didn't know we were monitoring, or didn't have a measurable way to monitor them. We increased our patient compliance. Now we're able to see all of our patients, whether they're transmitting or not, whether they're following the care plan by their physician, all of this compliance measured in one platform through Octagos. The reporting features and the analytics, several of my colleagues today, Alana and Carol, both talked about using their reporting and analytics to measure things like heart failure and different types of diagnoses. The seamless pre-authorization process. I didn't even have time to get into that one. But in our platform, there is a tab that helps, again, tell you if the transmission period and the billing cycle, authorization requirements through your insurances. And most importantly, it frees up the time for your physicians, right? It improves that physician's workflow by being able to concentrate on those truly, truly needed high alerts and weeding out a lot of the noise. Once those physicians sign the reports in Octagos, again, this is my favorite part, automatically downloaded into your EMR system if you get that interface, takes away that staff time of having to prep the charts, pull those reports from all of the websites, and keep up with those monitoring reports for that patient's next visit automatically in your chart. All of this definitely reduces our FTE cost so our staff can concentrate on spending that time educating our patients, freeing up the time for our physicians to be able to truly see those patients that need. And hey, we know that our first and foremost mission is to provide good quality care. We never sacrifice finances over quality for our patients. But if we do all of these things and do them right, having that increase in revenue for the practice, again, is just an extra added bonus that we are happy to get by working smarter and not harder. So these are all of the things that we wanted to provide you guys today with just some of the resources and the services of how we can increase our practice revenue, how we can increase our service and outcomes, and do things smarter. All right, next slide. I think at this point, we're actually ready to pass this over to the Q&A session.
Yes, Rochelle, thank you so much. I appreciate that presentation, and thank you for working through those technical difficulties earlier. So glad to have you join back and finish your presentation. We're going to go ahead and transition into the Q&A portion of our presentation today. Just another quick reminder to our attendees, if you did have any questions for Rochelle, Alana, or Carol Ann today, please be sure to use that chat function or the Q&A function at the bottom of your Zoom screen to go ahead and pose those questions. And we can get those delivered to them. We do have a couple already that I'm looking at. So we'll go ahead and start with a couple here. This one's actually going to be for you, Rochelle. So just how has remote monitoring really impacted your practice's financial performance? Maybe go into a little bit more of that. I know your last slide was a results-driven slide.
You got it. Thank you, Matt. Yeah, absolutely. So part of it is just watching that steady growth, right? You guys saw in some of the numbers in our slides, being able to see the steady growth of revenue. As we get more patients that are complying and enrolling in our Octagos remote monitoring service, you're starting to automatically see that revenue increase because we're now able to capture the consistent reimbursement. The system is basically designed to tell us when to bill. 30, 60, 90 days. It's giving those alerts for us automatically. And it's really making a financially stable process for us that's manageable and takes good care of our patients. And the one good thing I will tell you, when you saw our numbers starting from where we first started enrollment in 2022 to 2025 now, is it only took those first few billing cycles to be able to see that immediate enrollment. And why is that? It's because, again, once you can identify those patients, where they are they transmitting, getting them on a start, you're able to immediately start capturing patients that you would be otherwise calling to see if they could come in. When's the last time they had their device checked? Are they still alive even? Are these patients moved? Are they connected? So we were able to see that pretty quickly.
Awesome. Thank you, Rochelle, for that. I appreciate it.
You're welcome.
This second one's actually going to be for Carol Ann, actually. So Carol Ann, just what's the ideal timeline for seeing meaningful results from a remote monitoring program? It sounds like you guys are fairly new to at least the Octagos, but just wondering, when is that timeline for you in terms of seeing results?
It was actually very short. So a matter of mere weeks, we started to see a tremendous impact. I love the title of this entire webinar, that we are superheroes in our ability to make meaningful and sustained change in our practices. We had the benefit, as I mentioned, of really seeing immediate results. We had the pressure point of one of the platforms we were using previously was sunsetting. And so we were very motivated to see change happen rapidly. I was impressed by the fact that we actually reached out to Octagos to help us with the transmission, with being able to capture all of our patients and get them moved over. And I was concerned with our very small team, with our size practice, what kind of lift are we going to be responsible for shifting these patients from the two platforms we were using and the multiple manufacturers portals into Octagos. And they just took our hands and walked us through that very seamlessly. We gave them access to the portals. They registered all the patients. They contacted them. We sent letters letting them know that we were making a transition and what the benefit was to patients. And really, our cutover time from the prior groups that we were working with to Octagos was completely seamless. And as a result of that, we saw the financial impact right away. As Rochelle was mentioning, and Alana also touched on this as well, patients that had just been lost unintentionally previously were identified with this partnership. And so by nature of that, we not only saw the quality impact, the clinical improvement, but there was a financial benefit immediately.
Mhm.
That's great, Caroline. Thank you for sharing in those insights. Gonna go ahead and pass it over to a question for Alana as well. So just going into, having 10 years of experience, Alana, in the cardiac EP field. So I'm sure you've seen a lot of change, but just maybe you can touch on how remote monitoring can actually strengthen coordination between clinical and the administrative teams. Can you go into that a little bit?
Sure. Yeah, so remote monitoring in general, I think strengthens the partnership between clinicians and administration by building a bridge for us to really work together and reach out to patients more fluidly. But there are many challenges involved with that. And I think that it wasn't until we brought in the benefit of the third party vendor that we were able to sort of solidify that partnership. Using a third party rather than remotely monitoring these patients through all the vendor portals allows for clear delineation of responsibilities and also ultimately transparency. And I think that that is most important for strengthening that relationship between clinicians and administration. So when we can present our data, this is how many patients we have, this is how many transmissions, this is how many alerts, this is where our time is really being spent, and this is, in comparison, this is the revenue data. I think that speaking that language is important for building that relationship. The third party allows us to have a shared dashboard so we can all look at the same data in real time. It tightens up our coordination between administrative staff and the clinicians. And it also helped us to establish regular meetings, like cadences of checking in with each other, whether it's via email or as we were going live with the transition to this third party, we were able to provide education on both sides so that we can understand from an administrative perspective and a clinician perspective, sort of the importance of remote monitoring. So yeah, I mean, I think remote monitoring has sort of evolved organically over the past 10 years and has gotten to be this huge project that many institutions are having trouble getting their hands around, and utilizing a third party, it can be really helpful for that, for making sure that we're providing the care that our patients deserve.
Definitely. Well, I do want to do just one final ask. If anybody did have any final questions for our speakers today, go ahead and throw those in the chat. But just as we're waiting, just Rochelle, Carol Ann, Alana, any final notes that you guys had that you guys wanted to speak to as some potential questions may come in as we look to finalize this session?
I think one thing I can kick off, and I certainly want Rochelle and Alana to add to this, the power and the strength of the database and the AI engine with Octagos is really compelling. So Alana mentioned the fact that the transmissions are actually reviewed and the reports are prepared initially via AI. To be able to pull in the data, the results, the predictability of what's going on with patients through AI is really impressive. And to layer on top of that, as I mentioned, we've got the Octagos IBHRE certified reviewers actually putting their second set of eyes, as Alana called it, on those results. So that, again, ultimately frees up our in-house device techs to do the meaningful work, to not be dealing with inches or feet of paperwork, but actually putting their eyes, so third set, if you will, of eyes on the things that need clinical interaction. It takes away a lot of the noise, as Alana was referring to, and allows us to have the benefit of that AI engine working on our behalf that none of us could do in our own practices or our own institutions on our own. Rochelle, Alana, anything to add to that?
I mean, I'll just say too, just from seeing the service, knowing that there are truly humans that are the ones that are interacting. You've got these certified clinicians on the other end, gave my practice some comfort. We went from having, a team of people when we first went live with them down to, one main person in our office that coordinates. Hopefully she's watching this webinar today, but she does a lot of that. Shout out to Allison, who does a lot of the coordination. She, speaks with the physicians, but it's because they have the human, they use the AI together, and they provide that great data so that when the cardiologist or that EP is in there working, he can focus on what he really needs to work on and look at with that blended combination, team effort.
Yeah, I agree. I have to say that that's really what makes Octagos stand out, I think, is that they have the AI, but then also the IBHRE certified reader. And we do have great confidence that the transmissions that we're reviewing are accurate by the time they reach our desk. And it's really ultimately the most important part for how we can maintain our high level of efficiency because of that.
Awesome. Well, it looks like no other questions have come in, so we'll go ahead and wrap up this session. Thank you again to our speakers today, Rochelle, Carol Ann, and Alana. You guys did great. Thank you for the time, and thank you again to Octagos for bringing this webinar to us in sponsorship. If you guys did have any questions for Octagos, we'll be sending out a follow-up email, and then there is a follow-up survey as well, should you want to leave your contact information so they can get in touch with you. But that will wrap up our session today. Thank you again for joining, and we will see you in the next session.